Yeah, very good afternoon. Start ಮಾಡೋಣ. Okay. So, last class, if you remember, we started with a very important and an interesting group. Which was that group? Merc group. And we just finished one class. And if you remember, the entire class, we tried to focus on sphere of action and pathogenesis. Okay. Any quick questions, any clarification related to sphere of action and pathogenesis? So if you're clear, we'll go ahead. We'll continue with Merc. Now, if I'm right, this is the last slide where we had stopped. We discussed the action of Merc on the female genitalia. And if you remember, it would cause menorrhagia, abortion and anemia. This was the last slide. So that we have a small continuity where we stopped and how do we go further. Okay. Now, after sphere of action, ideally, what we do is we'll discuss what is the next topic. We are talking of generalities of Merc group. So we look at a very important point, an important aspect of Merc group, and that will be ailments from. Okay. So, what are your expectations as a PG student when we discuss ailments from? See, because when I was a student, when I was a UG student or a PG student, I definitely had this doubt. And the doubt was so many remedies under one ailment. Okay. So I really don't know if you have the same doubt or if your doubt is something different. Okay. So, but my simple question to you is, before I start, what are your expectations as a PG scholar? I've been repeatedly telling, as a PG scholar, when you're looking at ailments from, what is it that you want to learn or you want to understand?
What is the result from that ailment?
Okay, so for example, you have an ailment. So what will happen because of that particular ailment? Okay, good, agreed.
Differentiate remedies.
Okay, Padmashri also wants me to differentiate remedies having a same ailment. Good. Anything else? Now, ailments from, is very, very important. And ideally, we look at ailments from, when you're looking at the practical situation, we look at ailments from mainly in acute cases. Okay? Fine? And footnote 206. Whenever I'm giving you numbers, please check the numbers. I'm not very good at numbers. But in one footnote, Dr. Hanuman also talks of, ailments. When the miasm has bloomed, ailments have no scope, okay? Aphorism number 5, exciting cause. And exciting cause is very, very useful in acute cases. Okay, anyway, I'm just giving you a practical approach, trying to tell you where ailments can also be used. Okay. Anything else apart from what Dr. Padmashri just shared? Ailment, what will be the result of the ailment? Very important. And the other remedies, whichever come. How do you differentiate those remedies? Very, very valid. Okay. Anything else?
Why these ailments? What does these ailments speak about the drug?
Okay, fine. Okay, so why ailments and what does the ailments tell about the drug? Okay, yeah. See, now many of these ailments, are, if you look at the homeopathic materia medica, if you look at the sources of homeopathic materia medica, we have different sources. Many of the ailments, they are mainly from the clinical observation. Okay? Many of the ailments, they are mainly from clinical observation. For example, arnica has ailments from fall. Not that the patient during proving he had a fall. It is not what it means. And arnica, we also know, before we proved homeopathically, it had some, what are the sources? One source is empirical source. According to the empirical source, arnica was used for injuries. Okay? So this is what we homeopaths clinically observe and then we control. Okay? Yeah, we'll slowly take, one by one. The first very important thing is, when you look at causation, okay, many times in UG we limit only to this particular area. Arsenic, we talk of ailments from in arsenic. Or arnica, for example, we talk ailments from in arnica. Okay? So now what is very important, I personally feel, is you also need to understand what a remedy or what in a remedy an ailment is capable of causing. Okay? Now that is effect. One question that I will be answering what Dr. Venkatadri was asking is, see, the effect also reflects the miasm. Okay? Fine? Done? So if you have a serious illness, okay, or based on the illness you can also decide the miasmatic background of a particular remedy. We'll slowly understand and I'll try to explain. So first thing is, my simple question for you, as I was just trying to tell you, Mercury as a group is already done for you in your third year BHMS. So what I am trying to tell you is, I am just trying to understand from your end what you already know about Merc, so that it will be easy for us to take it further. So now quick question from my side is, kindly recall the ailments of Merc group. Ailments of Merc group. What are all the probable ailments? Suppressed? Okay. Suppressed is right, but what is getting suppressed? What is getting suppressed? Syphilis. Discharges. Okay. What is getting suppressed? Yeah, probably that is the first ailment I am talking of. Suppressed foot sweat. Okay? Suppressed foot sweat. Okay. Anything else apart from that? Mercury, Merc group. It could be physical, it could be emotional, it could be any of those things. Ailments. Huh? Okay, weather. Fine. We'll limit to weather. We'll look at which type of weather. Okay. Now if you're talking of weather, there is a specific weather in which Merc will have aggravation. Which is that weather? Huh? Wet weather, damp weather, cold weather. Okay. Ailments from anger. Okay, good. Any other ailments? We'll try to finish it in next 45 to 50 minutes. But I'm just trying to give you a model. I'm just trying to explain how a remedy or how a group study can be done. Practically, it may be difficult to teach every group in this particular method. But for a PG scholar, I'm just giving you a concept, how it can be studied, which will definitely have an impact on your practice. Okay. So wet weather, suppressed foot sweat, anger, and if you just look at your books, you have a big list. Okay. Starting from suppressed foot sweat, cold wet weather, damp basement, insect bite, gonorrhea, abuse of mercury, sugar, bad effects of vapors of arsenic, copper, anger, anticipation, fear, surprise, sexual excess, and they get offended very easily. This is how the list goes on in the Merc group. Okay. Anyway, we'll take each of them and we'll try to understand. The first thing that we have in the list is ailments from suppressed foot sweat. Okay. My first question to you is, how is the foot sweat getting suppressed? First question. Okay. And this is very important. Probably this is how you should also start thinking. How will the foot sweat get suppressed? Okay, if you understand this, then we can go to the next level. What will happen because of suppressed foot sweat? So how is the foot sweat getting suppressed? AC, anything beyond AC? Okay, AC could be a very simple reason. Suppressed foot sweat, meaning somebody is having a foot sweat, okay, and then something is done, something they do, then the foot sweat stops, after which they land up with some complaints. Now the question is, how is the foot sweat getting stopped? Okay. Huh?
Anti-perspiration creams.
Okay, you are using some creams, good. Okay, for example, using some fungal creams or some cream, some powder you are applying, which will stop sweating. And you also have a surgical method wherein people, they block the sweat pores. Okay, feet is the area which has got maximum sweat glands. Okay, and it sweats very profusely. So you have some techniques which will block the sweat from happening. Okay, or like for example, you apply something, you apply some creams, you apply some powder, some antifungal creams, something which will stop the perspiration, and then people will come with some other complaints. Or it could be as simple as a patient going to a homeopath for foot sweat. Homeopath gives some medicines for foot sweat. Foot sweat vanishes, and then they land up with some other complaints. It could be as simple as that. Okay. So, what are the other remedies that comes to your mind? When Padmashri said, sir, do discuss the similar remedies so that it will be a better learning for a PG scholar. So, how is what you have understood? Now the next question is, which are all the other remedies which also has ailments from suppressed foot sweat? Good. Cilicia? Barretta? Very good. Cilicia, Barretta. Agreed. Good. Then any other remedies that you can recall? See, there are a few from your repertory. Barretta car, Barretta mure. Cilicia, aurum, arsenic, sulfur, soranum, colchicum. These are few remedies which have ailments from suppressed foot sweat. Okay. Now quickly, can you recall what will happen in Barretta because of suppressed foot sweat? Okay, they will have more of throat inflammation. Yeah, there can be tonsillitis, more of throat pathology. Inflammation, sore throat, tonsillitis, which comes after suppressed foot sweat is Barretta. Good. Cilicia, aurum, arsenicum. And Barretta can also have pain in heart. Or heart complaints after suppressed foot sweat. And the other remedy you can also have is aurum. Okay. Arsenic will have more of palpitations. Anyway, you have a slide coming up next. I thought before I expose this slide, I can have some inputs from your side. Sulfur, say colchicum, the only remedy mentioned in your source books which will have paralysis after suppressed foot sweat. The only remedy is colchicum. Okay. Anyway, we'll quickly have a image, and you can understand things better. Headache or suicidal disposition. There is a rubric which is mentioned in your repertory. Headache, one part. Suicidal disposition, headache with from suppression of foot sweat. Suicidal disposition, headache with from suppression of foot sweat. The only remedy is Merc. The only remedy is Merc. Okay? Done? And second thing is, what is this? From the image? Very good. You see blurring, blurred vision, cataract. Blurred vision, good. Cataract. Weakness. Under generalities, you have a rubric. Weakness after suppressed foot sweat. Only remedy mentioned is Cilicia. Good. Okay. And you have epilepsy. you have palpitations. Okay? So fainting, convulsions, palpitations, suppressed menses, nose block, cataract, dim vision. This is all what you have in silesia. So after suppressed foot sweat, these things are possible in solution. Okay. Now we have throat affections, we have heart affections. Which is the remedy? We already discussed, Barretta. Pain in throat, pain in heart after suppressed foot sweat is Barretta cough. Okay. Going ahead, we have giddiness, vertigo. Your suppressed remedy, the last remedy of our materia medica. Zinc. Okay. Zinc has vertigo after suppressed foot sweat. Okay. And you also have pain in heart. We discussed this. Ailment, Barretta and Ailment, pain in heart. And asthma. Asthma after you have two remedies, sulfur and silesia. Asthma after suppressed foot sweat. Okay. Similarly, we discussed this. Which is the remedy? Paralysis. Paralysis after suppressed foot sweat is colchicum. Okay? Colchicum. Yeah? Okay. See, now we are trying to go a step ahead. Okay? And I hope you got an idea that a single causative factor you can understand in a different dimension. First try to understand, like Dr. Vijaykrishna was asking, how can this happen? Is it part of proving? From where did... See, you should have that inquisitive mind. Materia medica is very vast. Trust me. And unless you don't have that inquisitiveness, you will not get convinced. So a doubt should come. Whether I am capable of answering your doubt, that is secondary. What I can, in my limitation, I will definitely try to answer. What I don't know, I can refer. But that should not stop you students from asking doubts. Okay? So from where did all this ailments concept come up? What is the practical utility of the ailments? Okay. And what will happen in each remedy? It's very, very important. So you saw suppressed foot sweat. Okay. Different remedies giving rise to different effect. Hope I am clear. Okay. So if you study like this, you will start feeling more, you will start feeling more realistic and you will start appreciating materia medica better. Okay. Now the second thing that we have here is, I'll just share a small case. Afternoon classes are, very difficult without something which is practical. See, we had a lady, and it is New Year. We had a lady in our clinic yesterday who had come to us with nose block, sinusitis, and she's got cough. Okay? So what is the simple thing you ask? What is the simple thing you ask? Since when? How did it start? Okay. So she had been to the church 2 days back, which was the New Year Eve. They had some mass in the church, and 3 a.m. she returns on her two-wheeler to her place. Okay? And weather, Bangalore weather, it's very cold and it's very damp. So 3 a.m. in the morning, she gets exposed. And then, she starts with nose block, cold and all. So how do you interpret this case? Now when you're talking of the importance of ailments from, okay? Now how do you interpret this case? What is the simple ailment? Exposure to cold damp weather or cold wet weather. Okay. And looking into the small totality, what remedies come to your mind? Very good, beautiful. Dr. Krishnadas is talking of Dalcamara. Agreed, good. Only Dal? Aconate. How is it in Aconate? Aconate is sudden, and in Aconate it's more of dry cold air. Here we are talking of wet cold air. Okay. So Dalcamara, Dustox, good, agreed. Bray will be again more of hot weather. For example, it was 3 p.m. and it was very hot. She was under sun and then she comes home, tired. Okay. After a day, the brain has got a very slow onset. Okay. Yesterday she gets exposed and must be after 24 hours or 48 hours, she gets into problems. That is brainia. Slow, insidious onset. Okay. So dull camera, restox, natum cell, very good, natum cell, antimplant. Okay. What is it you have on spider? Arenia diadema. Okay. Rhododendron. Fine. Many of those remedies. So this lady we had given a dull camera. Simple case, dull camera. Okay. So cold, wet weather. You have rightly told so many remedies. Starting with ammonium, arsenic, badiaga, calcarea phos, lot of remedies. Your repertoire gives many more. I have just taken the 3 mark remedies and I have just cut and pasted it over here. Okay. So damp, wet weather is a causative factor in Merc. Now, cold, wet weather, like the previous thing, we'll have the similar exercise. What can dull camera cause? Or what is dull camera capable of causing when a person gets exposed to cold, wet weather? Okay. See, based on his disposition, he might land up with different problems. Okay. So, in dull camera, there can be inflammation of the eyes. Okay? Inflammation of the eyes, or there can be hardness of hearing. There can be hardness of hearing, or there can be paralysis of the tongue. Only remedy mentioned in your repertoire, mentioned in the source books, which has paralysis of the tongue after getting exposed to cold, wet weather, dull camera. Okay? So, paralysis, they can have pain in umbilicus. Pain in umbilicus, very specifically mentioned after exposed to cold, wet weather. Dull is the single remedy mentioned. Okay. Diarrhea, you all know diarrhea, dull camera, we have heard of it. Again, if I am right, the only remedy mentioned for abortion after getting exposed to cold, wet weather. See, as a student, you might be having this feeling, oh, when will these things come? Will these things really come? I was sharing with Dr. Venkat the other day. I am into homeopathic practice for almost 25 years now. This August I will be completing 25 years. Trust me, never used squilla. Never used squilla. Imagine, a homeopathic teacher. Never used squilla. I never got an opportunity to use squilla for last 25 years. The other day he took a case of a young boy, who had cough. And what we also observed is, when he is having cough, he keeps rubbing his nose, rubbing his face. Okay? Fine? I shouldn't have exposed the remedy before. I should have asked you, which is the remedy which has rubbing nose, rubbing face by coughing. And the remedy is squilla. Okay? And first time I give squilla in clinic, and the lady comes back, and the mother comes back and says, "Sir, 3 months we have struggled with different specialists, different pediatrician, and my son is not better. And after coming to you, 3-4 days, he is doing very fine, he is absolutely fine." You are getting my point? So, who thought, okay, I never imagined that, I am using squilla, or even if I am using squilla, I never thought I will be getting this PQRS. So what I am trying to tell you is, these things are given by stalwarts. Okay, like for example, Kent, Herring, Nat Hanuman, whoever it is, the stalwarts. So don't take them light. Have them. So what I always keep telling you is, have the knowledge. You never know when, at what stage of your life people might walk into your clinic. But don't neglect. Sir, what's our abortion? How will abortion happen? I mean, if I am sitting there, at least you did not ask me the question. You did not ask me the question, because from our gynec knowledge, we have a different perspective of miscarriage. Right? But you will be surprised to see all these things happening. Okay? And they're all genuine symptoms. So please have a knowledge of all those things, and application as in when patients walk in, as in when you find them, you can start applying it. And they work beautiful. Okay? So abortion during or after getting exposed to cold, wet weather. Okay? Huh? Yeah, very good. No, that's what I was just trying to tell before that Amrish caught me. Now, for example, if abortion has already happened, that is not the situation. Here it is more of threatened abortion. Okay? There is a threat that the mother might abort. She might have a mild bleed, or she might have the signs of abortion. In that situation, when you give Dulcamara, it might prevent. Okay? Done? Hope I am clear. Okay. See, remember, or you can also have another situation where the lady might come to you, like for example, you have apis, you have other remedies. There you can use it as a constitutional remedy. Sir, I aborted thrice during 3rd month. She did not come during that time to meet you, but she has come later. Sir, not that I am not conceiving. I am conceiving, sir, but I am aborting. Okay, there that can be taken as a constitutional thing, and your medicine can prevent further abortions happening. Hope I am clear. So when they are coming in that state where there is a threat of aborting, it can be used. Or if abortion has already happened, we can't help it. But she comes to you with a scenario where she's been aborting. There your constitutional remedy can prevent further abortions happening. Okay. So we'll go ahead, and this is all what can happen in Dulcamara because of exposure to cold, wet weather. Now, hardness of hearing, diarrhea and headache and body pains is also possible in reflux. Okay? Asthma. Rakesh was talking about one remedy. Asthma, natrum sir, beautiful remedy, clinically verified, cold, damp weather, cold, wet weather, natrum sir. Which is what is the diathesis? Hydrogenate constitution. Okay. So you have natrum salt, medorinum, Dulcamara again. And in Merc, our focus will be Merc. What can happen in Merc group when they get exposed to cold, wet weather? They can either have headache, they can have hardness of hearing, or they can have diarrhea like reflux. Okay? This is Merc. Paralysis. 3 remedies: Dulc, Nux, Causticum. Okay? Dulc, Nux and Causticum. So, Dulcamara, reflux, Merc is what we predominantly explored. We look at few more things here. Okay, so this was about exposure to cold, wet weather. Okay. Now we are looking at a very important aspect, and that is bad effects of mercury. Ailments from bad effects of mercury. Now before I start from my side, what, as a PG scholar, what remedies come to your mind? Bad effects of mercury.
Nitric acid.
Very good, nitric acid. One of the top remedies, Arum. Yeah, majority of the acids. In that, nitric acid tops the list. Arum, hepar. Okay. Arum, hepar. Okay. And you are also talking of nitric acid. Done. And what is this? Phytoleca. Mesothelium. Soranum. Okay. Zincum, if I am right. Okay, anyway. Sulfur, Phytoleca, Stephysagria. There's a big list. I've just taken a few important remedies for you. So, Aura. See, so beautifully mentioned in your repertoire. Now, again, before I take you a little more in detail about this particular topic, you need to understand that Merc as a remedy was abused. If you look into the history during Hahnemann's time, for any damn problem they used to give mercury. Okay? Fine, what were the common diseases that Merc was used for? It could be syphilis, it could be ulcers, it could be bone pains, or it could be any problem. Okay? Merc was abused. And then they slowly realized that Merc is very toxic. And now you don't see Merc being used in our in allopathic medicines so much so that they used to use it before. Now it is used mainly for what is this, filling, amalgam. For filling it is used. Okay, it is used in vaccines, a small amount. Okay, is what it is used for. But way back during Hahnemann's time, it was abused. And if you also see sexual diseases, syphilis and all was at the peak during this time. Okay. Now what you need to understand is, Aram, if you look at Aram, sadness. Fine. I don't know how practical this particular thing will be in the present scenario. Okay, because Merc is not so very much used as it was used before. Okay. But you should know, sadness coming after bad effects of mercury, the remedy is Aram. Aram Mure, heparin and nitric acid. Okay? And if you have headaches, again, asafoetida is one more remedy we missed there. Asafoetida, Aram, heparin, nitric acid. In many situations, you see nitric acid and heparin, coming on and on. Okay? You also have hardness of hearing from bad effects of mercury. Then you have asafoetida, carbovage and nitric acid to antidote them. You have weakness, this is pain in throat. Pain in throat, which is nitric acid and heparin. Diarrhea, heparin, kali iode, nitric acid, sulfur. Diarrhea. And you also have paralysis. Okay? And again you have heparin and nitric acid. In many of the situations, you see heparin and nitric acid. So, bad effects of mercury, abuse of mercury, what can happen in different remedies is what we have tried to have a look at. Now, before I take you to the next slide, what did we discuss? We are talking about a very important component of Merc group, and that is ailments from. Under that, we discussed first thing, which is suppressed footstep. And second thing we also saw was exposure to cold, wet weather or damp weather, damp cellars. I have clubbed everything there. And third thing we spoke was abuse of mercury. Okay? Fine? Now what are the other causative factors? I have showed you in the first slide. Anger, those are the emotional thing, we'll take it late. Anger, then any other physical ailments that you can recall? Insect bite, good. We have insect bite, we have arsenic. Something you missed in between was sugar. I'll just see if the sequence is right. Yes, absolutely right. So we have ailments from sugar. Bad effects of sugar. Okay. We can have some small interaction here because I know you know a set of remedies which will have complaints from sugar. So can we have the small list quickly? Argentum, yes. Topping the list will be argentum. Argentum nitricum. Good. Apart from argentum, any other remedies that you can think of? Yes, good. You also have natrum phos. Yes, there is a complaint, specific complaint in natrum phos. They generally have acidity. We'll come to it. Natrum phos, good. Graphitis. Yes, graphites, natrum phos. Graphites basically has aversion. they have an aversion to sugar. Okay? Aversion to sweets.
Spongy.
Okay? Yeah, it will cause cough. Okay, aggravation. Ignitia. Good. Ignitia is also there somewhere. I'll just explain. Ignitia also has more of GI complaints coming up because of sugar. Okay. See, there are few remedies. Argentum, you also have calcaria, you also have lycopodium, Merc, and one surprise thing you also have here is oxalic acid. Sulfur, zincum. Zincum is coming, in many of the comparison in this particular remedy. See, when you have bugs, when a person after taking sugar, if he complains of empty bugs, then the remedy is Raphanus. What else you have in Raphanus? What else? Incarcinated flatus, good. I had recently given Raphanus to a man. Aversion to girls. Aversion to opposite sex or aversion to women. That's not the case, but it's also there in Raphanus. This man felt he has got some serious illness. This rubric delusion, he has got a serious illness which the physician is not able to identify. I don't remember the exact rubric, but that's how it is, And the only remedy mentioned there is Raphanus. Again, I did not have Raphanus. I had to purchase Raphanus for this particular gentleman. Okay. So, Raphanus has, we generally think of Raphanus for GI complaints. Post-operative gas pains. Okay. But do think of Raphanus here. And when the eructations are sour, what is the rubric?
Delusion, this is unrecognized disease he has.
Okay. Delusion, he has an unrecognized disease. Nobody is able to recognize the disease that I am suffering. I got something. When you have a patient with this particular situation, Raphanus is the only remedy we have. You can think of Raphanus. Okay. So we'll go ahead and we'll look at the other things in Merc, ailments, sugar. This is what we are trying to focus. Eructations, sour. Dr. Vijaykrishna was talking of natrium phos. You also have causticum and sulfur. Heartburn, okay, sulfur and zincum. And if you have pain in stomach, this is what Dr. Ambrish was talking of. You have ignitia here. Oxalic acid, sulfur and zincum. Okay. And any wild guess which is a remedy which can cause flatulence? Only remedy is argentum. Okay, argentum metricum. And if the person has flatus, if he is passing loud flatus after eating sugar, again the only remedy is argentum. Okay. Now, can somebody quickly tell me the beauty in argentum? What is the statement?
Loves sugar, but he can't.
Yeah, the statement is crave sugar, but sugar disagrees. Okay, fine. They love sugar, fine. But if at all they eat sugar, they'll have some issues. Okay, argentum. Diarrhea. Again, wild guess. You have argentum here, you have sulfur here, you have oxalic acid, and there is another rare remedy, thromium. You have heard of this remedy? Again, a remedy for lower GI complaints, diarrhea, loud, noisy stools, urging, aggravation after eating, drinking. Rare remedy, as an assignment, you can refer Bore, Clark, and you can try to have a small picture of this particular remedy. Okay? So this is all the remedies and what these remedies are capable of causing in because of sugar. Okay. We have remedies, we have ailments. Like for example, we have ailments from insect bites. Okay. Better remedies? Apis, ledum, calendula, echinacea. Did I share a small case? Okay, I don't know how much time we have, but anyway, one of our past student of government college, Bangalore, in a remote village, she had a relative who had a insect bite, and they were not aware which was that insect. Okay, and she was going into acute renal failure. And that remote area, doctor said, we can't do anything, you'll have to take her to a higher center. And they were planning some procedures. That's when this girl had called. And, I told her to give a remedy. And she being a student of this college, she said, sir, already that remedy I have given. Which was that remedy? Ledum. So I told Ledum on a WhatsApp message, she said, sir, Ledum already given, no change. Okay, so what to do? Now what is the seriousness of this case? Because of an insect bite, her kidneys are getting compromised and she's going into a septic state. Her WBC, everything is very, very high. And that's when the physician there said, we'll have to refer her to a higher center. Okay. So when you have this kind of a situation, when you have septicemia, kidney is going into compromise, the remedy is echinacea. I repeat, echinacea, not ignitia. ECH, echinacea. Okay. Again a small remedy. I am a man who believes more in constitution. But today just now I gave you 2 examples where I have used small remedies. Okay. So if I only think of big remedies, then we will be missing these small cases. Okay, I shared squilla, fine, and with results. I gave you the follow-up, beautiful results. And even this case of echinacea, okay, beautiful results. Her creatinine came down, her blood levels came down, and they could manage with our homeopathic medicines. So echinacea. See, you should, don't be biased. Don't be biased about anything. Have everything. This is the age for you to learn. And I am trying to tell you, don't expect them to come immediately. They can come any part of your life, but you should have that knowledge. Fine? Okay, only if you have the knowledge, you can use it in a proper way. If you don't know, then you can't use it. So echinacea was a beautiful remedy. Artica urens can again be a remedy for bee stings. Where do you think of Artica urens in bee stings? When you are more of urticaria, urticarial eruptions, hives, HIVs, the old terminology. After insect bite is Artica urens. Okay? So ailments after arsenic. Okay? There are a lot of remedies mentioned in your books, but limiting to Merc, what we see is when they have difficulty in breathing. When they have difficulty in breathing, after getting exposed to arsenic vapors, one remedy could be Merc. Okay? Yeah. Impeded respiration after getting exposed to arsenic vapors is Merc. Okay? Now, what is this? Oh, very good, surprise. So what is the surprise I have? Dr. Krishna Das. Good, surprise, absolutely right. So when we say surprise, what remedies come to our mind?
Coffee.
Very good, coffee. Good. There are 5 remedies from my, very good, Gelsemium, good, it is there. You are done with 2, 3 more. Which is the remedy I am dealing? Merc, so Merc, good, 3, 2 more. You also have opium and verat. This is from my old repertories, must be new repertories, might be having many more remedies. Okay. So ailments from surprise, 5 remedies. Gelsemium, coffea, Merc, opium and veratramol. Okay. So what will happen in coffee? Because of surprise. You all know coffee is a remedy which is very excited, very into. Ailments from joy. You have coffee. Okay. Surprise. Ailments from surprise in coffee can give rise to sleeplessness. Okay. Headache, palpitations. Okay. You have a surprise visitor, you have something surprise, boyfriend just dumps in, or you get a call, whatever. Any surprise can cause all these things in coffee. In gelsemium, there's only one symptom, and that is weakness. Only remedy mentioned, weakness which comes after surprise. So surprise should cause excitement, but in gels, it will cause muscle weakness. Okay, only remedy. And in mercury, the remedy that we are focusing, you will have a lot of things. There can be a cough, easily frightened by surprise. There can be trembling, single remedy. Trembling after surprise, Merc is the single remedy. Easily frightened by surprises, Merc is the single remedy. Hope I am clear. Insect bite, bad effects of arsenic, and ailments from surprise. Ailments from surprise. Okay. We will talk of two more ailments, and this is ailments from sexual excess. Quickly, other remedies. Sexual excess. Staphysagrina, Agnus castus. Good. Staph, Agnus castus. Two remedies. Caladium. Lycopodium, selenium, yes, agreed. Fluoric acid, picric acid. Picric acid, a better remedy will be picric acid. Okay. Now each of these remedies will have its own symptoms. Like for example, you are talking of Agnus. What will happen in Agnus? What might also happen in Caladium is they will be going into impotency. The direct result of sexual excess in Agnus is they go into complete, what is it called, the penis will become flaccid, okay, and there will be absolutely no erection, okay. But before you would have indulged in too much of sexual activity, that is Agnus. Okay. So in Merc, there can be headache and there can be indigestion. Headache and indigestion from sexual excess. You can also think of cinchona. What will happen in cinchona? Loss of seminal emissions. Phosphoric acid, cinchona. Okay. And ailments from fright. Hopefully this will be the last ailment. Ailments from fright. Again, you might be having a lot of remedies, starting with aconite, opium, gelsemium, arsenic, argentum, you have plenty of remedies. Okay. So focus is, in Merc group, what will be the effect of fright? Lot of things. Coryza, indigestion, slow digestion, pain in the abdomen when you have the tenesmus. Merc, I'll talk to you about tenesmus in the next class. When I tell you about the characteristic symptoms, I hope you're all very much familiar with the tenesmus, pain tenesmus, sore pain in extremities, chills, rigors. All these things happening after fright. And surprisingly, Merc is the only single remedy rubric mentioned in the above effects that will happen because of fright. Clear? So, before we close, a quick recall of what we did. So we mainly focused on ailments term. Okay? Ailments from, for a PG scholar, we looked at what the ailments are, what are the other remedies having a similar ailment, and what each remedy is capable of producing. Okay, this was a small exercise we did. So we had foot sweat, suppressed foot sweat, we had exposure to cold, wet weather, then bad effects of mercury, huh? Insect bite. Before that we spoke of sugar, bad effects of vapors of arsenic, surprise, sexual excess, fear, fright, anger, yeah, surprise. So these were the few ailments. Okay. So any quick questions? Anything you would like to ask? All fine? Okay. So in next class what we'll try to do is we'll try to look at the physical appearance, we'll try to look at the thermals, the diathesis, the miasm, and we'll start with characteristic symptoms. See, I mean, if you want, thermals, mercury is ambi. It is called human barometer. So, it is ambi, thermally. And if you're looking at diathesis, it is mainly scrofulous, glandular diathesis. Okay. And miasm, all the three, but predominantly syphilitic miasm. And how do they look? Generally they look lean, thin, weak, emaciated, debilitated. Children with large head, okay, is how they physically look. So that we need not spend extra time in the next class. So next class directly we'll start with characteristic symptoms. What we call it as characteristic particulars or characteristics of Merc group. Okay, and then when time permits, we'll take the mind and the modalities and clinical utility of Merc group. So must be 2 more classes. We'll try to finish Merc group in general, and then we'll take up few small Merc remedies. Merc group of remedies. That is the plan. Okay, fine? Okay, thank you.